During this video, we're going to take you through each of the steps required to perform an ulnar nerve entrapment test. Firstly, ensure that the patient is relaxed and ask them to place their arm on the table with the palm facing up. Next, it's important to make sure that the patient's skin is clean, and this can be done with an alcohol wipe or some soap and water. Next, ensure the two parts of the electrodes have been separated. We can put the finger part to one side, and we're only going to focus on the receiving part of the electrode. Turn that over and remove all the protective film. Now we're going to look at the electrode placement, and if you take the packaging, you can see that there's measurements on the packaging. If you find the position of the medial epicondyle and then measure up 7 to 8 centimeters between the biceps and the triceps, it usually falls right in the middle. And for the purposes of the video, I'm going to make a mark on the skin with a pen. With the position noted on the skin, we take the electrode with the red arrow pointing towards the wrist. Stick that on, and then take the earth and place that on the biceps. Next, we're going to put the cables onto the handheld device. Here we have the sensory receiving cable, and this has no print on the terminal, whereas the motor has motor written on, and that's how you differentiate between the two. If you turn the device over and then look at the back of the cable, you can see there's a red dot. That aligns with the red dot like so. Same with the bar stimulating cable. This also has a red dot which lines up with the red dot on the back of the device and is pressed in like so. Now I'm going to put the sensory receiving terminal onto the electrode like so. That's flipped over upside down, and then it's secured tightly with the strap. So you can see the terminal is tightly against the electrode and doubled back on itself. During this test, we're going to stimulate the median and the ulnar nerves, and you can see that on the stimulating bar there's an arrow, and that arrow points to the arrow that we saw earlier on this electrode, and it will be placed on the median nerve like so. It's kind of midway on the wrist, and then the ulnar at the same distance from this electrode in the same place as the median nerve, and that's how we will place the stimulation bar. Note that the bar has two studs. It's important that we put some either ultrasound gel, just a small dab, or some water to help with the conductivity of the signal. Moving on to the test itself, we'll place the stimulation bar onto the median nerve. Then get the device, switch it on, it'll ask you start test, you say OK, and then you raise the stimulation level to 1 to get a baseline. And then from there you start to raise the stimulation gradually. Ask the patient, can you feel it?
Yes.
And as we go higher, I'm at 17, 18, 19, 20, we'll start to see the finger and the thumb twitching. If this doesn't happen, you may want to move stimulation bar slightly and keep raising the stimulation. I'm now at around 40. Let's try and move that stud slightly again. Now you see the thumb has started to move as well. At this point, I think we've reached the highest peak for stimulation, so we press OK. Save a number of results, and then press OK a second time to save that. And that's the median nerve tested. Okay, now for the ulnar test. Again, arrow to arrow in the same position as we had previously, but this time placed on the ulnar nerve. Press OK to start. Raise the stimulation level to 1 just to get the baseline, and then progressively go up again. And it's really important with these tests that you have enough stimulation to get a good result. More is generally better, bearing in mind what the tolerance of the patient is. You can see now that the hand is twitching quite well. I think we've reached the peak there, so I'm going to accept that. Save multiple results, and then press OK again, and the test is complete. Okay, so once we've completed the test and we've pressed the Done button, it takes us to this page. And you notice here we have all the patient information. This is key that we have this correct up front, and that the patient's height and weight, particularly for this test, have been inputted correctly. Then if we head over to this UNES, which is grayed out at the moment, and click on it, it brings up the waveform tables. So let's quickly look at those. And you can see that the algorithm has placed 3 dots on each graph. You've got the median and the ulnar nerve graphs. So the first of the 3 dots is the onset latency, and that's when the peak starts to form. Then you have the peak latency, and then at the bottom, the positive peak. Now, you don't need to worry too much about what these dots represent, but it's important to note that all 3 are there. If they're not, it's possible something has gone wrong in the test, and you may need to redo the test to ensure that you get these 3 dots in place. But you can see a nice clear peak on both the graphs, which is a good sign. And then if you go to the summary table, scroll that up, what we have is the peak latency for the median nerve and the peak latency for the ulnar nerve. And then we have the difference between these 2 values here, the 4.47 and the 4.87 is 0.4. So that's been repeated here. It's the same thing. And then that result is corrected using the patient's height, which I mentioned earlier. And then you get a kind of traffic light report over here, and that's 0.69. So this one is green, which means there's no nerve entrapment. If there was, this would be in a red box, and it would be above this value of 1.3. It would be an abnormal value, and therefore it would be marked in red. So this is green, and we know it's good.